Is healthcare a privilege or a right?
Healthcare is something that every single person in this nation needs to have access to. And the society itself has to determine how that works. My grandfather graduated from medical school in 1908, a long time ago. When he cared for individuals, he cared for everybody that came through the door, regardless of their insurance status. I graduated from medical school in 1979. In my 20-plus years of practice, I cared for every single person that came through that door, regardless of whether they had insurance. So a society
Did you take Medicaid?
Absolutely. So a society has to, among itself, have that conversation about what the public policy is. There are consequences to every single decision that you make in that construct. If you view it as the role of government to provide health care for everybody, that's a way that you can move. But there are consequences to that frankly, I believe, violate those principles that I suspect we all hold dear. Decreasing quality, decreasing affordability, decreasing choices for individuals. So that if you have a system that more fully respects individuals and fully respects the kind of society that we've been accustomed to, that is one that allows individuals to be the people that are choosing what kind of coverage they have, then you move in the direction of where we're trying to get.
I want to hit a whole bunch of other things, including the opioid epidemic and NIH, but I want to stay with this for 1 minute because I've been thinking about this for a long time now. I was meeting once with Julia Gillard, who is the ex-prime minister of Australia, and we were she's like most Australians, big fan of America. And said that her one critique of America was that she noticed a level of desperation on the part of people that people in Australia didn't feel, and that desperation was related mainly to health care. And she brought up, I'll never forget this, she brought up the idea that in Australia, people are shocked that in America, people have to have car washes to raise money for transplants or bake sales and that sort of thing. And she said we don't understand that. Our system doesn't allow for that. And so Australia has a pretty good healthcare system. So I'm asking this just as a layman and as a consumer. Why is there that level of desperation? And Obamacare didn't solve that level of desperation, obviously. Well, why do we have this desperation? Why does the employer-based healthcare system, why does Medicaid being only for people, Medicare being only for people over 65? How do you fix that? And I assume you want to fix that. I assume you don't want your fellow citizens to be desperate. Go ahead and to experience medical bankruptcy, which is a uniquely American concept.
One of the goals that I hope to be able to move in the direction of in whatever tenure I'm given the privilege of leading this department is to restore part of the trust that I believe has been lost between the electorate, between the citizens of this nation, especially the physicians of this nation, and their federal government when it comes to health care. Because if there's no trust, then you can't have confidence that the decisions that are being made in the federal government are going to be helpful to the American people. I think that the core of the answer to your question is that we don't have a system of health care. We have systems of health care that oftentimes don't speak to each other, that don't communicate, that don't work in concert with each other. We have a system right now that if you were to take a clean piece of paper and to design a healthcare system, it wouldn't look anything like the system that we've got. So the goal is to get to a point where that seamless transition between those systems is possible for individuals so that nobody loses the opportunity to have that coverage.